Florida lawmakers will consider a massive health care plan when they return for the legislative session next month. The state Senate president, a Republican, says it'll grow the health care workforce, increase access, and spur innovation. Critics, though, say it's missing a vital piece of policy. Capitol reporter Forrest Saunders with more.
With something like 1,000 people moving to Florida each day, high-ranking Republicans say the state's healthcare industry is struggling to keep up.
Everybody needs health care. In Florida today, we do not have enough healthcare personnel to take care of the Floridians that are living here.
Enter Senate President Kathleen Passidomo's Live Healthy legislative package, around 8 pages in $900 million worth of ideas. Some specifics: it removes barriers for foreign-trained doctors to work in Florida, loosens rules for out-of-state nurses and physician assistants, expands telehealth and mental health care, and increases the poverty level threshold to access free and charitable clinics.
Well, what we know is we have a robust system of those clinics across the state of Florida, and what it does, it opens up the clinics to more people.
Early reviews of the idea sound positive from the movers and shakers in the GOP supermajority. Florida's House Speaker saying this week the proposal has been collaborative between the chambers.
I think there's something there that benefits the healthcare system broadly, and there's just a lot to like there. I think it'll have a lot of bipartisan support.
But at this point, Democrats think there is a glaring omission in the package: no Medicaid expansion, which the Senate president dismissed as a, quote, talking point, saying the goal of her legislation is quality, efficient, effective, and economical care.
We want to talk about live healthy. We need to make sure that people have access to health care. By expanding Medicaid, we would bring down another $4 billion in federal funds into Florida's healthcare system.
House Minority Leader Fentress Driscoll noted Thursday that Florida is one of only 10 states that haven't approved a Medicaid expansion. She said residents here are struggling with affordability, while benefits of expansion are left on the table.
Maternal health rates have improved. It helps rural hospitals from having to close down. It helps prevent emergency room visits. And so I'm very disappointed to see that this act, or the proposed Live Healthy Act, does not include anything on Medicaid expansion, because Floridians need it.
At the Capitol, Forrest Saunders, WPTV News Channel 5.
Back with Brian Crowley. It's been the debate for years now, the tug-of-war between Republicans. Say they don't want to be tied into Washington and what happens, they argue, when the money runs out for Medicaid expansion. Democrats, you heard Ms. Driscoll talking about the concerns there. Your thoughts on this vital topic?
Well, it's interesting that you would give up $4 billion coming from the federal government. I'll take it if they don't want it. Yeah. But look, in fairness, this is a big step that the Senate is trying to take. We'll see whether or not the House and the governor ultimately support them in this. I think one of the most important things that the Senate president recognizes is that we've had a huge influx. Millions of new people move into the state, many of them elderly. And you know, we don't necessarily have an increase in the size of our medical component in the state. So do you have enough doctors? Do you have enough elder care providers? You know, I was talking to a doctor not long ago who was coming up for a contract. You know, it's not the little family doctors anymore with their, you know, small offices. They all work for big companies, sometimes for hedge funds. And as her contract was coming up, she was told that she could only spend 15 minutes with a patient. They want to churn them through. And as she said to me, she said, I don't want to spend just 15 minutes with an elderly patient. There's a lot of needs in this state, and I think this attempted legislation is addressing those needs, and I think it's a very wise move that they're making.
The debate, of course, will go on Medicaid as a piece of that kind of expansion and availability. Brian, what else top of mind for you as we start hurtling toward the end of this year and the beginning of what's going to be a historic 2024?
Well, the Florida Republican Party is having huge issues as we get ready to enter the election season in serious mode, like we haven't been already. You know, the party chairman, Chris Ziegler, has been charged with sexual assault. We don't know whether or not, or he hadn't been charged yet. He's being investigated for sexual assault.
Says he's being wronged with those allegations.
He says not true, that the woman that's accusing him was actually in a threesome, which he acknowledged with he and his wife Bridget, who is one of the founders of the Moms for Liberty. So there's a lot of turmoil. There's been calls for him to step down as chairman of the Republican Party. Even the governor has said he should step down, but so far he has resisted stepping down. But there's a lot of weirdness in this, and it's going to keep going.
We talk so much about the horse race and personalities. So you talk about it, the economy, number one. Democrats feel they're not getting enough credit nationally, and therefore that trickle-down effect on the economy. Republicans argue it's for good reason, because people still don't feel like the inflation monster has loosened its grip. But as we look at the issues themselves that will drive us in 2024, if we can get past for a moment the personalities, you have the economy, abortion issues still very much front and center, what's going on overseas. How do you kind of weigh and balance and give our viewers perspective on what to look for issues-wise as we move to 24 that you think will really ultimately drive what you do?
Well, no question the economy is number one. It always is. It's, you know, when you pull up to the gas station in October of 2024, if you're paying $1 for a gallon of gas, you're pretty happy. If you're paying $5, you're mad at somebody, usually whoever's in power. The same with groceries and everything else. So we don't know what the economy is going to look like in October, but it will be the number one issue. Abortion will be a big issue in many states. I'm not yet convinced it'll be as big an issue in Florida, but we'll see. And then, of course, what's going on in the Middle East will be a huge issue. You know, those who support what's going on, Israel's effort to defeat Hamas will be looking carefully what the administration is saying, and those who are concerned about what's happening to Palestinian civilians in Gaza will also be listening carefully, and how whoever the Republican nominee eventually is addresses those issues. And Joe Biden, who must deal with those issues over the next year, is going to, I think, have a significant impact. And then there'll be a lot of talk about the woke issues and China and all those kinds of things. And, you know, whether or not woke issues will play in the general election, I'm not as sure, but it's certainly going to play in the primaries.
I was going to ask you about that culture war divide, and you beat me to it. You're just not sure how to calibrate how much impact that'll have then.
Well, I think it's going to be state by state. I think there's going to start being some weariness with that as an issue. I think some people may, you know, is worrying about the one transgender kid when you have hundreds of thousands of students as important as worrying about health care, which the Florida Senate is doing right now. Is it as important as worrying that you have enough doctors to take care of people, that you have enough nurses to take care of people, that you don't have, you know, I know someone has potentially a very serious disease, and in trying to get doctor's appointments has had to wait 4 months. 4 months to see a doctor. That never used to happen. I think those kinds of issues are going to pop up perhaps a little more than the woke issues as we move forward.
And of course, Florida, we have housing affordability, insurance, which are very much state issues. It'll be interesting how candidates for national office may try to latch into that. Any sense of that?
Well, I think there's a distinct possibility that if Ron DeSantis were to become the nominee, I think the White House would be talking a lot about how home insurance is out of control in the state, and we don't want him, you know, having bad policies if he gets elected president. And it could hurt him with Florida voters. Ron DeSantis has not been doing well in recent polls, and, you know, I don't really like polls, but I think his popularity in Florida has actually declined. He spends very little time in the state anymore.
Last 30 seconds, talk about the governor. If he's not the nominee, talk about what his future looks like. Does he have a 2028 future? If, big if, but get your crystal ball out just for a second.
Well, I'll give you my make-believe, which I actually think there's a small chance that this would happen, that if he drops out of the race in, say, January, early February, that he announces he's running against Rick Scott for Senate.
You heard it here first, folks.
Be quite a race.
Indeed it would. Brian, as always, thank you for being on the leading edge of all things political. We appreciate it. We'll be back with more in just a moment.